As you may all know, it is National Healthcare Week, and we want to take this opportunity to thank some people. I want to start with a sincere thank you to our patients in our community. They have been faithfully compliant. They have followed all of the directions and instructions and suggestions that we have offered. They've postponed care appropriately when needed, and they've sought emergency care when it was necessary. And they have done this with a great attitude. And so we are very appreciative for the sacrifices that they've made to accommodate us in this time. We want to thank our employees. It's National Healthcare Week, and we want to especially thank the nurses and frontline staff who have been so earnest in their work and have taken it so seriously to provide great care for the people of our community. It is really an exceptional time for us. We had a great year ahead of this event, and we have found that our staff and particularly our clinicians have really leaned into the challenges of COVID, and so it's been very gratifying. So I want to turn it over to Dr. Mike Scalzone, our Chief Quality Officer, to talk a little bit about his views on this.
Thank you, Dr. Scopoletti. Thank you, everyone. In the previous briefings we've had, I focused a lot on preparation and on readiness for a large portion and a large amount of COVID-related patients to come see us. Gratefully, we have not seen a lot of COVID patients. We certainly do have patients in the hospital, and we have seen patients in our ambulatory offices, but the number of patients that we've seen have gotten to be fewer and fewer each week, and the number of tests that have been positive have also been fewer and fewer each week. That's allowing us to sort of open up our care to needed but less emergent procedures and less emergent care. Things like mammograms, routine healthcare visits, elective surgeries that are both needed and important but not emergent. We can do this in part because we've fulfilled multiple criteria required by us from our counties, by our regions, the north central region of Pennsylvania and the southern tier of New York. We straddle two states, of course, so we have to comply with regulations on both sides. And while that's sometimes complicated, it often makes sure that we are very safe for our patients. In order to fulfill those criteria, we need to have enough space in our hospitals. We need to have enough ventilator capacity, enough protective equipment for our staff, and we have to have enough testing. And so testing is really important. Other times when we have spoken, our testing was limited. I think you all know weeks ago when this first began, many institutions in many areas were limited in the amount of testing they had. Gratefully, we have a good portion of testing now. We can really expand the testing that we do. We've been able to test all the patients that require that for caring for their symptoms or if they have to be admitted to the hospital. We have enough tests that we can check all of our preoperative patients, so anyone that's going to have a procedure. And we can support the needs of our nursing homes and our local nursing homes when they have mandated testing that the states are requiring. So in New York State, all of the nursing homes have to have their staff tested twice a week, and in Pennsylvania, once weekly. So that's a large volume of tests, but we do have that available and we can help them out. Those tests that we're talking about are the diagnostic tests. So those are the ones that you're familiar with. It's the cotton swab that's placed either in the nose or the throat, and it's designed to test whether the virus is present. So that's what we use clinically to determine if someone is ill or at risk to become ill. That's different than the antibody test, and I think everyone hears about the antibody test. And that's not one that's clinically useful for us for an individual patient. That test is really about prior exposure to the virus, had someone been infected in the past or exposed in the past. And that's used more in a public health perspective to try to understand how widespread the disease is in the community. So that's available, but it's important to recognize it's really not about clinical care, that's more about public health. But what that tells us is going forward, we're really going to have two parallel systems of care. We will always need to have readiness for our COVID patients. We'll need to have space and equipment to take care of them. But we also need to be able to do the routine care and the important care that our patients have been needing and that we've always done for them. So these systems can be complementary, and they will be, and we're prepared for both of those. So it's a new phase of monitoring. The pandemic is not behind us, of course, but we're prepared to walk down both of these paths. Importantly, that means safety is first. And because of that, we need to make sure that we keep track of all of the needs to take safe care of our patients. And so as you'll see, as you come in, everyone is screened for temperatures and wearing masks. We ask questions about whether they've had any recent symptoms. And you can see the social distancing that we require both for a press conference like this, as well as for visitors to our institution. Some visitor restrictions still persist. That's both good common sense and required by some state regulations. And we understand that's really difficult. To not be able to come in to visit your loved one or to stay with them while they're in the hospital is very difficult. But we're grateful that our patients understand and their families understand this is about safety, to keep them safe and to keep their families safe. And for now, those restrictions remain in place. I can't emphasize enough something that Dr. Scopoletti said. He said, patients coming to the emergency room for severe care. Across the country, we have seen, and we have seen as well, many fewer patients coming to the emergency room. And while that may sound like a very good thing, sometimes we worry that perhaps they're not coming in for serious problems, that they're staying at home longer than they should if they're having chest pain or shortness of breath, perhaps signs of a heart attack, or if they're having slurred speech or facial drooping, signs of a stroke. So I just really want to remind everyone, if you have any of these symptoms that could mean a serious condition, don't hesitate to come to our facilities. They're safe. We're prepared for both patients that have COVID, might have COVID, and don't, and it's important to not ignore those medical conditions. As I said, we're going to be resuming some more of our routine care, important surgeries and procedures, and I'm going to ask Dr. John Olmstead to come talk to that. John is our Chief Medical Officer of Corning Hospital, as well as the Regional Medical Director of our Western region.
Thank you, Dr. Scalzone. I'd like to take a few minutes just to give a status report on our surgical services for the Guthrie system. As you know, we essentially ceased surgical operations in mid-March, and that was in order to prepare our providers, our staff, and our facilities for a potential COVID-19 surge. We limited surgeries at that point to emergent and highly urgent surgeries. I would like to thank all of our patients who had their surgeries postponed during that time. We sincerely appreciate your patience and flexibility as we've all had to navigate through this. And I know it's been very scary for many of our patients waiting and wondering when their surgeries would be rescheduled. Over the last few weeks, we've been actively ramping up our surgical services throughout the Guthrie system. We've been diligent in preparing our operating rooms and procedure suites so that they are clean and safe environments for our patients and our operating room staff. We have followed national and state guidance throughout the reopening process. And like Dr. Scalzone said, we continue to screen our patients and staff upon entering the facilities. We are continuously cleaning high-touch and high-traffic areas. And we continuously monitor our PPE supply and usage to ensure that we have a sufficient supply for all of our operating room staff and providers. And all of these procedures are in place to reassure all of our patients that Guthrie is a safe place to have your surgical procedure. Each of our Guthrie facilities that are performing surgical procedures have processes in place to maintain social distancing and to support our current visitor restriction policy. And our providers are keeping in touch with our patients' families through phone calls, and we're also leveraging our telemedicine capability to help enhance those discussions. When there's critical discussions like intraoperative findings or postoperative instructions, we do allow a single visitor to be with the patient. Currently in Pennsylvania, we're performing all elective procedures. And although there are very few truly elective procedures, these procedures are non-emergent procedures that are essential to a patient's health. And we want our patients to be healthy, and we are now ready to perform those surgical procedures that will get our patients on the road to healthy living. In addition, we need to resume some of those procedures that are screening procedures. Our gastroenterology department is open and actively performing screening colonoscopies. And we do that so that our patients can stay on track for their preventive health maintenance. In New York, we're performing outpatient elective surgeries. These are surgeries in which the patient goes home the same day or the next morning. Guthrie Cornea Hospital, the Big Flat Same-Day Surgery Center, and Guthrie Cortland Medical Center are all increasing capacity to care for our patients in those regions. We are confident that we can continue to increase the volume of procedures that we perform over the next weeks to months. And we have an excellent team that will be monitoring the national, state, and local directives, the prevalence of COVID-19 in our region, and the supply of critical PPE so that we can continue to provide excellent surgical care, but most importantly, keep our patients and our staff safe. Thank you, and at this point, I'll have Dr. Scopoletti come back up.
So lastly, I want to touch on our community, and in particular the supporters in our community who are donors and partners to our organization. And I want to share with you a few examples, but I want to start by saying there are now well over 300 individuals and businesses who've made contributions of goods, services, cash donations, a variety of ways that they have come kind of unsolicited, come forward to help our organization at this time. And we are extremely grateful for the support that has been provided to us. But I do want to highlight a few examples. First, Corning Incorporated and Dr. Mike Lappy and his team, who have been a longtime partner with this organization, but in this particular time have come forward with a variety of tools, if you will, to help us do our jobs better, easier, and safer. And they have been a great partner. TCC Gives, which is a subsidiary of Verizon, made sure that our patients can stay connected by donating 20 video-capable tablets to the organization so that our palliative care team and hospice team can connect patients and their families together at a time when visitation was not allowed. So this was a really humanitarian effort on their part. Individual business owners, I want to highlight Gary Vargason, Vargason Technologies, who served both as a content expert. His company has expertise in UV light and sterilization processes with UV light that we tapped into to look at how we can sterilize and reuse certain PPE products. But he also repurposed his manufacturing facility to build us face shields, and then donated approximately 2,000 face shields to the organization to be used by our staff. Other manufacturing companies, Lockheed Martin and Siemens Dresser Rand, who shifted their production to make face shields, and to date they have collectively donated more than 5,000 face shields. We've had a large group of volunteers at local libraries and schools who pulled out their 3D printers and manufactured products like the face shields or headgear, ear rests, so we don't hurt ourselves with those face masks we have to wear. And in addition, many community members who sewed together cloth masks that many of us are using in public. And then there was a group of community individuals and organizations that sought to provide us with food. When it was difficult to get meals, they were around for us to help us with that. There were people who donated money. We set up an emergency response fund, Guthrie Emergency Response Fund, to help people who were troubled. Maybe they were furloughed, maybe they were community individuals that needed some money to get through this month's bills. We have been gratified to find that people have donated now to that emergency fund $58,000 in just the last 8 weeks. This allows us to respond quickly and be prepared should a surge of additional patients come through. We're going to provide you with a list of all the donations that we've received and the donors, but just want to be sure that we publicly thank our community for their great generosity and understanding at this time.